What's the latest on perioperative blood pressure management? What are the potential adverse health effects of microplastics in the environment? Can intra-arterial alteplase after thrombectomy improve functional outcomes for patients? This and much more on today's JAMA Editor's Summary. Hello, and welcome to our listeners around the world. Today is Friday, October 17th, 2025. I'm JAMA Deputy Editor Dr. Linda Brubaker, sitting in for Dr. Kirsten Bibbins-Domingo, the Editor-in-Chief of JAMA and the JAMA Network. I'm joined today by JAMA Deputy Editor Dr. Preeti Malani. Hello, Preeti. We have plenty of interesting research to share. Let's get started.
Hi, Linda. The first research article is about perioperative blood pressure management for adult patients in the IMPROVE multi-trial. Dr. Seigel and colleagues evaluated whether targeted blood pressure management during surgery could improve clinical outcomes. They enrolled more than 1,200 participants, 45 years or older, who were undergoing elective major abdominal surgery at 15 German university hospitals. All participants had at least one high-risk criteria and were randomly assigned to receive either individualized perioperative blood pressure management or routine blood pressure management. Individualized targets were calculated from preoperative nighttime mean arterial pressures using automated blood pressure monitoring. Routine management used a mean arterial blood pressure target of 65 millimeters of mercury or higher. The primary outcome was a composite outcome of acute kidney injury, acute myocardial injury, non-fatal cardiac arrest, or death within the first 7 postoperative days. The researchers reported that individualized blood pressure targets during surgery did not decrease the incidence of composite adverse postoperative outcomes measured.
Thanks, Preeti. The PRETREAT randomized clinical trial is another JAMA trial that evaluated intraoperative blood pressure management. Dr. Kant and colleagues focused specifically on intraoperative hypotension, which is associated with adverse outcomes after surgery. They investigated if a proactive, risk-stratified blood pressure management strategy to prevent intraoperative hypotension could improve functional disability at 6 months using the 12-item World Health Organization Disability Assessment Schedule 2.0. The investigators randomly assigned participants to mean arterial pressure targets based on the risk of intraoperative hypotension or blood pressure management at the anesthesiologist's discretion. Although the trial was stopped early for futility, the investigators reported that the use of proactive mean arterial pressure targets based on intraoperative hypotension risk did not improve functional disability at 6 months.
Drs. Legrand and LaMontagne wrote an editorial for these 2 studies with JAMA statistical editor and anesthesiologist Dr. Romain Peraccio. The editorialists review the similarities and differences between these trials and what their conclusions could mean for blood pressure management in perioperative medicine.
Thanks, Preeti. Let's turn to JAMA's newest stroke trial, the PEARL randomized clinical trial. Clinically, patients with stroke due to large vessel occlusion have suboptimal functional outcomes, even with thrombectomy. Dr. Tang and colleagues evaluated whether intra-arterial alteplase could improve functional outcomes in patients after successful reperfusion following acute stroke. The investigators included more than 300 patients in this multi-center trial from 28 hospitals in China. Following successful thrombectomy, participants were randomly assigned to receive either intra-arterial alteplase treatment or standard treatment. The primary outcome for this study was the proportion of participants with a modified Rankin scale score of 0 or 1 at 90 days. The investigators report that among patients with acute anterior circulation large vessel occlusion stroke who achieved successful endovascular reperfusion by thrombectomy, receipt of intra-arterial alteplase resulted in a higher likelihood of excellent functional outcomes at 90 days.
In the accompanying editorial, Dr. Seitz and Leslie Mazwi emphasized that patients with large vessel occlusion urgently need more solutions, and the results from the PEARL trial are an energizing lead. However, they caution that intra-arterial alteplase remains investigational and more evidence is needed before widespread adoption.
Preeti, let's see what's in this week's JAMA research letters. Dr. Nagata and colleagues explored an important and relevant topic: social media use trajectories and cognitive performance in adolescents. They used data from the Adolescent Brain Cognitive Development Study to determine if greater social media use would be associated with lower cognitive performance. The investigators report that in this national study of over 6,000 adolescents, both low and high increases in social media use were associated with lower cognitive performance in certain areas.
In their editorial, Dr. Madigan and colleagues argue that despite the study's limitations, policy actions that address social media as a public health concern should not be delayed. In another research letter, Dr. Iduma and colleagues described results from a cross-sectional analysis to estimate population-level prevalence of pathogenic variants in key cancer susceptibility genes. Using data from the All of Us study database, which enrolls U.S. participants regardless of health status, the authors found that just over 5% of individuals carry pathogenic or likely pathogenic variants. This evidence could help refine personalized cancer screening or surveillance among patients in whom a pathogenic variant is found.
And speaking of genetics, JAMA published a Viewpoint this week about genetic testing in women's sports, which is featured on the new JAMA Plus Women's Health channel. Dr. Tran and colleagues explain how new leadership on the International Olympics Committee may be shifting away from earlier frameworks that emphasized inclusion and fairness for athletes with differences of sex development.
There's plenty of clinical content as we enter the fall season here at JAMA. JAMA Senior Editor Dr. Derek Angus and other participants of the recent JAMA Summit on AI published the JAMA Summit Report on Artificial Intelligence. They reflect on new AI tools in healthcare and highlight target areas to ensure equitable and effective use of AI tools in healthcare settings. JAMA Plus AI Editor-in-Chief, Dr. Roy Perlis, talks more about the article with Dr. Angus on the JAMA Plus AI Conversations podcast.
So first of all, let's be really clear here. I am gaga about AI. I am not a skeptic. I really think that I almost wish I was 30 years younger. Like, it would be brilliant to be starting my career with sort of all of these tools. It's like we just got handed the keys to the fastest, most exciting car you could possibly imagine. And then you discover that there's sort of no highway system, and there's no guardrails, and none of us have actually been taught how to drive. And so we have this incredibly powerful car, but sort of no real system for how to drive it around, no real driving skills.
And yet we're driving it anyway.
Oh, Lordy,
we're all
are.
out there driving it.
Heads up, visual learners, there's even more to learn in the accompanying video.
Preeti, as you know, unfortunately, syphilis cases are increasing in the U.S. and worldwide. In a detailed JAMA review, Dr. Chevalier and colleagues summarize current evidence about syphilis diagnosis, treatment, and more. Your conversation with Dr. Chevalier is a great JAMA Clinical Review podcast for those who want to listen and learn more about syphilis.
The JAMA Insights this week is on another hot topic, microplastics and health. Dr. Mahalingaya and colleagues discussed the growing awareness of this concerning public health issue, especially the presence of microplastics in human tissues. JAMA Deputy Editor Dr. Kristen Walter joins author Dr. Christiani to talk about how these microplastics can have potential adverse health effects.
Just because microplastics are detected in human tissues and organs does not necessarily mean they're causing harm. Can you discuss observational study data about the known and potential health effects associated with microplastics in humans?
Knowledge about this is quite incomplete, and it's in an infantile stage. We have a few studies of workers who have been exposed to high levels of this with some adverse respiratory effects. A couple of really good studies in the last 12, 24 months show that individuals with carotid artery plaque, arterial plaque, those with higher concentrations of microplastics as detected on mass spectroscopy were something like 4.5 times more likely to have a myocardial infarction, stroke, or death from any corals with 34 months of follow-up from the measurements. So relatively short term, but not that bad. It's almost 3 years. It was a recent study of microplastics in brain autopsy. There seemed to be higher concentrations in brain tissue than individuals with dementia. But again, I would say we're really at the very beginning to understand the human health effects of these compounds. Because as you said, the presence of them alone does not prove causation of disease. And the measurements are basically exposure measures, biomarkers of exposure, and then associate with disease.
And a shout out to all listeners with an interest in rheumatology. Try the JAMA Clinical Challenge about painful hand swelling with finger contractures in an adult woman. The full history is in the article. What's your diagnosis, and what would you do next?
There's been a lot of rapidly developing medical news. Our outstanding JAMA medical news team stays on top of it all and gets you the latest articles in clinical medicine, biomedical research, public health, and health policy. Find it all at jamamedicalnews.com or click on the link in this episode's show notes.
Thanks, Preeti, and thank you for tuning in to hear what's new at JAMA this week. These highlights were brought to you by Dr. Preeti Malani and me, Dr. Linda Brubaker. This episode was produced by Daniel Morrow, Ella Barnes, Shelley Steffens, and Dr. Krista Roberts at the JAMA Network. A link to this JAMA content can be found in the episode's show notes. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com. And thanks for listening.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.